Today's module is on repetitive stress injury. This is in a sense a hand and wrist tendinitis, but it doesn't fall neatly into one of the well-known syndromes we might otherwise encounter, such as tennis elbow or carpal tunnel syndrome. It might coexist with those other specific diagnoses, but typically RSI, repetitive stress injury, has some features that really are not specific, at least to most practitioners' understanding, and yet it does need to be treated. It sometimes is also called cumulative trauma disorder, or CTD. The importance of an early diagnosis is to help patients maintain function, and typically this does not involve specific trauma, but one often has to adapt or even eliminate aggravating factors, for example, what might be part of their workstation activities. And I'll discuss that more when we go into the exam room. Okay, so for repetitive stress injury or cumulative trauma disorder, this is more non-specific. We've looked at other syndromes in the wrist and hand and elbow. And this is often something you can't really pinpoint a specific diagnosis. You almost hope it's something like carpal tunnel syndrome because that's actually pretty treatable. But the patients don't have that diagnosis per se. They just have a generalized pain in the hand and wrist associated with various activities, such as fine motor activities. Sometimes there's tenderness at the pisiform, among the carpal bones, or towards the radial styloid process. But again, non-specific findings. They might have some tenderness by the medial epicondyle, but not a classic finding of medial epicondylitis or golfer's elbow. Unfortunately, this can be either career-ending for patients or severely debilitating. I actually developed some signs of repetitive stress injury 23 years ago when I was using a laptop a lot in front of patients. I tried to, very early in my career, use laptops to document patients' physical exams. And it ended up being that I had to stop altogether. And ultimately, I had to use voice recognition systems, which fortunately have gotten better and better. There are other interventions you can do for this disorder. For example, some people believe that excessive pronation will make this condition worse. Pronation being like this. So there are ergonomic keyboards that are not so pronating, where you allow a little bit more of a neutral position. Correct monitor height, correct keyboard height, avoiding reaching activities. These are all very important. Voice recognition systems. Sometimes you have to switch your mouse from the right to the left or alternate between those. Getting back to what we've talked about in other modules, I would screen more proximal structures, the neck and the shoulder. Not because we're going to find specific findings there, but if the patient has poor posture and weak scapular muscles, it often makes more distal problems, such as wrist and hand problems, worse. So those are all considerations that we would have in this condition. It's often not a specific trauma. It's sort of a straw that breaks a camel's back. You know, the patient sort of has maybe some tendinitis, they go back to work as a barista, and then 3 months later, they're working overtime, and they can't really go much further. Very frustrating for a provider. You know, we have a tendency to disbelieve patients when we can't help them, and when they're non-specific findings. But it's a very real disorder, and something that's not easily treated. Sometimes people try anti-inflammatory diets of various utilities. Some people believe that hypermobility, generalized hypermobility, predisposes you to this problem. Some people believe there's a proximal median nerve entrapment. At least one very good hand surgeon in our area in the Puget Sound believes this and does surgery to release this nerve. But electrodiagnostic studies don't reveal that nerve entrapment. But this surgeon believes that there can be very subtle improvements in strength of the finger flexors, for example, after the surgery, releasing a subtle entrapment that might cause this kind of repetitive stress problem. Basically, difficult injury, and if you are starting to develop this, you should take it very seriously. Ergonomic experts, such as occupational therapists, can sometimes help with all that accommodation I mentioned already.